Hi, my name is Laura Kiefhofer. I am a certified lactation counselor and I'm a mom. I have 7 kids and I am on here today to talk to you about adoption and breastfeeding. The reason why Breast asked me to do this video is because they knew that my youngest son, who's adopted, I also was able to partially re-lactate, and I nursed him using a supplemental nursing system, an SNS. So they asked me to do a little video about my story. So I will say that we had not planned on doing an infant adoption, so because of that, I didn't have a lot of time to prepare. Typically, a lot of women who are looking to adopt an infant have months and even years to prepare and go through the Dr. Newman Protocol to be able to produce their own breast milk. Women can do this who have never breastfed or had a baby before, and obviously re-lactation is if you've already had the baby. You've had your own baby and then are trying to re-lactate for whatever reason. So in our case, I had about a month to prepare for the birth of our son. And so I used DOM, which is a medication that is used as part of the Dr. Newman Protocol, but it is illegal in the United States. It's something that you have to order from overseas. There are times when it can be seized at customs. And so that is something you have to consider when going through that protocol. I used a combination of taking that as well as herbs and pumping. So I pumped every 2 hours around the clock. I took the DOM and I used some herbs. I will say that with only having 30 days, I wasn't successful with having a full supply. I was making maybe a ½ ounce to an ounce per day, which is absolutely not enough to breastfeed a baby with. But what I did then was used a supplemental nursing system, and it's a little tube connected to a bottle. You can make your own or you can buy systems. There's a couple on the market, and you thread the tube from the bottle, and I taped it to my breast, and I would latch him for nursing with the tube in his mouth, and then he would suck like he was breastfeeding and suck the milk right out of the tube. We did a combination of donor breast milk and an organic formula to feed him. I didn't have enough donor milk in order for us to fully give him that. So my goal was that he got some donor milk at least with the formula. The questions are, what was the biggest hurdle you had to face when nursing a non-biological child? So the biggest thing was not being able to produce my own breast milk. I think that was really hard for me. I was a successful nurser with my 4 biological kids, always had an oversupply, and I guess I just assumed I would be able to do it. So I think that was the hardest thing for me. What are your biggest tips for inducing lactation? That's another question. So I would say to start as early as possible. Like I said, I had 30 days before he was born, and it wasn't enough time. Ideally, you want a minimum of 6 months in order to have your best possible results. Are certain supplements successfully used to induce lactation? Yes. Goat's rue and blessed thistle combined are really what are recommended. And oatmeal, brewer's yeast, those types of things that you would use just to work on upping your milk supply in general. Those are what are recommended. When is it helpful to use an SNS? So, well, lots of times you can use an SNS. As an adoptive mom, obviously I used it mainly to feed my baby, but it can also be used to do finger feeds by dad or siblings if you don't want to introduce a bottle yet. We also, I actually used it over the past weekend with one of my clients who was having problems getting baby to latch. Baby was really sleepy and didn't want to eat. And so we used that to get baby to kind of wake up a little bit more and start drinking, and then was able to get baby to latch. So sometimes they can be used in the first couple days. Sometimes they need to be used long term. In my situation, it just really it just depends. Maybe a biological mom who had breast surgery can't, for some reason, breastfeed. She could use that instead if she can't produce her own milk. There's a lot of reasons why an SNS can be used. How can you best support a mama that is nursing a non-biological child? Treat her like any other mom that's breastfeeding. Don't treat her like this is something abnormal, or treat her like, that she doesn't know what, that it's crazy, sorry. Just treat her like any normal nursing mom and just encourage her. And if she needs donor milk, maybe you can help her out with that. But just encourage her like you would any of your other breastfeeding friends. That would be my advice. And what is the best advice you could give a nursing mother? Sometimes breastfeeding is super easy, and sometimes it's a little challenging. And no matter what, you just kind of have to work at it, and it's worth it in the end. I don't regret any time I spent trying to breastfeed my son or our outcome. Even if I wasn't able to produce enough breast milk to nurture him myself, we still had that bond that nursing provided. And he and I are super close, and definitely that helped our bond. I really believe that. So I would say just keep at it, and if you're having a hard time, reach out for help. Reach out on Breast Roanoke, reach out to an IBCLC or a CLC, and we're always happy to help. Thank you for listening.